Bauer, and I am one of the pharmacists here at Ascension Borgess Medical Center. I've been a pharmacist here for about 14 years, and I currently work on the general medical oncology unit of the hospital. And as people know, that's a pretty can be pretty doom and gloom. We see a lot of patients with cancer and terrible diagnosis. So I think our chaplains here do a wonderful job of supporting the families and on the patients when they do come in with these medical emergencies or given a very bad diagnosis. I think they do a wonderful job of offering support and counseling to the family members and patients in need. As an employee, it's been especially helpful for us to have the chaplains come around with candy or treats every once in a while and some fun music just to bring up the morale and to kind of make us feel like we're all serving one purpose and we're all one family. So overall, I'm very grateful for our chaplain services, and I hope they continue to serve our patients and the staff. It's wonderful. Thank you.
Hi, I'm Shayla. I'm a nurse at Borgess on 4 North. Some general things about the chaplains here are very friendly, very outgoing. When I first started here, I didn't know any of the chaplains. I always had to look them up on Volt and see who was here. There's a lot more of a presence now with the chaplains that are here today, so that's really appreciated. I know everyone on our floor, our PCAs, even some of our patients, like when on Wednesdays when our snack cart comes. I also personally, I enjoy hearing prayer in the morning and at night twice a day. It kind of helps me gather myself and get ready for my day, or helps me kind of slow down at the end of the day and take a breather and then go home with a clear mind, not with work on my mind. All in all, I do, like I said earlier, I think I've become more known with our chaplains within the last couple of years, which I think is awesome. So keep up the good work.
Jeff Kraler. I'm a cardiac nurse at Borgess Medical Center. What I've observed with the chaplaincy is that when there's issues, when a patient's very anxious and nervous and upset, that we notify the chaplain to come here right away and they talk to them. They help with the staff to deal with the patients more emotionally, more caring. And I find it personally that they also talk with the staff too. When staff's having a bad day, I've found that the chaplains can actually give support, which I feel is invaluable. So my conclusion is that we need chaplaincy, we need to have more staff and chaplains, and that they are very big of a benefit for the hospital.
I'm a nurse on the cardiology unit at Ascension Borgess. I love having the chaplains around for mostly family and patients that are here when they're in need. They're very in a vulnerable spot while they're here, and it's nice to have someone when they need to talk to someone, or when we do have those moments where we lose patients, for families to be able to have someone to talk to during that time. I also like having them around for us staff also. They like to come up and check in on us and bring us treats and encourage us to keep doing what we, are here to do and provide for our patients. Thank you.
Colleen Donnelly. I'm a nurse case manager at Ascension Borgess, and I feel that chaplains have a very important role in our caregiving here at Ascension. I'm a case manager. I do interview patients, and I always ask them if having a visit by the chaplain or a priest would give them comfort, and so I feel that I keep our chaplains hopping. So yes, I do appreciate them. From a personal perspective, I do have my master's in pastoral studies, and so I myself find comfort in those studies and feel that providing spiritual comfort is very important to meet the person's holistic caregiving. So I'm very affirming in their role here at Ascension Borgess and appreciate them very much. And as for a staff person, I find them very receptive, supportive, courteous, respectful, and also share a good sense of humor along with a delicious snack cart. So thank you, chaplains.
So my name is Fahad. I'm a medical student here at Borgess. I've encountered the chaplains around the hospital, just always being very helpful, very important in patient spiritual care. Personally, they've also been very kind. Recently, I just noticed that they're always very involved with everyone's personal and mental health well-being. Recently, we had I forget what it's called, like a treat cart, where chaplain brought in a treat cart, and it was generally a great morale booster for everyone on the floor. In conclusion, I think that overall the chaplaincy is very beneficial for both people that work at hospitals as well as patients. Thank you.
Hello, my name is Susan Hanna, and I am the Apache coordinator here at Ascension Borgess in Kalamazoo. I work with the critical care services, but I also work with Gift of Life and our end of life programs in association with our chaplains here at Borgess. My general observation of our chaplaincy in the hospital is it's a much needed and much appreciated service that's provided to our patients, but not just the patients, but to the staff as well. We have survived our biggest challenges with COVID, and it was with them by our side that we were able to get through this time frame and come out somewhat whole on the opposite end, which is very encouraging. They are not only visiting our patients and talking with them and servicing the patients in their prospective field in the hospital, but they do that same service for our staff as well. It's very uplifting and appreciated from all of the staff. Their daily presence in our unit, their availability from a call, and to do what they do that sometimes our staff and other family members may not feel comfortable in providing for that specific patients. Personal benefit for myself is that their involvement with the Gift of Life honor walks, actually doing the honor walks for us, that family contact, the family meetings, end of life issues that come up. It's sometimes uncomfortable for us, but with their training, their professionalism, they make it happen, and it's appreciated by all. Can we do without this service? No way. This is a service for our patients, our families, our staff, physician, nurses, housekeeping. Everybody benefits from this service. And without this service, I think we'd be all floundering fish out of water. So we appreciate them, and thank you for being here.
I'm Crystal. I'm a respiratory therapist here at Ascension Borgess. I've been doing respiratory here for just about 5 years. And as far as the general observation with the chaplain ministry, I feel that it's a very important part of the healing process, not only for our patients, but for their families. And I know at times they're not always going to be around right away, but they do make their way, because there's only a few far between. As far as, the affirmation or positive points, they're just very welcoming. They are very, I don't want to say not upbeat, because they're always upbeat, but it's not just a matter of talking the word of God, but they're there sometimes just to listen. If somebody isn't real religious, they'll sit and they'll just have a nice little conversation with their patients and like I said, and also with their families as well. From my benefit, I know especially during COVID, in that it was always nice when they're around. I know Chaplain Ben, when he was here, he came up and played his harp for us, which was awesome. Can't say enough about that. but just adding little personal, personal attributes from them, or just coming around and blessing us and saying hi and letting us know that they're here if we needed. But that's what I feel. I feel chaplains are very much needed, and they need to be here all the time. They should be here 24/7.
Charlene Minema. I have worked here for housekeeping since November. Physically I have seen the chaplains interact with our other employees here, on a daily basis, every now and then, interacting with our patients, which that I absolutely love, because it always seems to put our patients in a very good mood, I have noticed. So it's always nice to see a smile on their face with that. And then yes, every Wednesday, seeing the chaplain up here interacting with the employees and with our snacks and drinks and everything, it really lightens the mood in this type of job. So that definitely makes it a better day almost every day. So, and yeah, I think that's about it. It's nice just seeing them interact with all the employees and patients and everything. It always puts a smile on everyone's face.
This is Lori Townsley. I am a nurse practitioner with the medical oncology service here at Ascension Borgess Hospital. How I use in general observations about our chaplain service here is we deal a lot with poor prognosis, difficult diagnosis, and death and dying with our patients. And the whole treatment part of a patient includes more than just physical, mental, but a spiritual aspect as well. And that really comes into play with us here with our practice at Borgess. So I find them very helpful. A lot of times they can help augment or contribute to pain control issues that they might be having if they're having some spiritual distress, anything like that. So I definitely see benefit to them and would very much need them to continue. Personal benefits, they are a nice sounding board. If something is going on, they're great for resources. So in conclusion, definitely keep them, have value. Thank you.
Hi, I'm Kelsey Hagenbaugh. I'm the RN Heart Failure Coordinator here at Ascension Borgess in Kalamazoo. I was at the bedside as a nurse for about 5 years prior to this role, but I still come to the bedside for patients and their families to help educate them about heart failure. So sometimes they just need somebody to talk to, and sometimes I can help fill in that void, but the chaplains are here for the same reason too sometimes. Maybe they have families that are hours away, or they can't come in because of other reasons like gas prices going high. And over the years being a nurse, I've seen the chaplains touch people in more ways than one. I've seen them be there for patients when they're taking their last breath, or when they're in acute distress, or they just need somebody to talk to because their families are too far away for them to come in and see them. And the chaplains here are just wonderful at responding to requests, to seeing patients, praying with them at the bedside, and just being there for them spiritually. Thank you.
Cameron. And I'm Liz, and we're both PCAs here at Borgess on 4 North.
Something that has really stuck out to me is how the chaplains are always available to a lot of the patients as well as the staff, and always address any concern or spiritual concern that anyone might have, which is also beneficial for staff, because sometimes after a long hard day it's easy to talk to someone, and they're always there for you. And another personal benefit for me would be the snack carts and like the little music and it's kind of like after a long hard day you kind of have just like a little break where you kind of like your mood changes and you're ready to get the next few hours done, and everyone's kind of together, which makes it all much easier.
I agree with that completely. I also think they bring a very calming experience to the family members as well, not just the patients.
They provide comfort.
Yeah. I
It's
think
nice
they're
to have them
definitely
around.
essential for Borgess to
I
have.
agree.